Hi, beautiful, beloved souls. I have a doozy of a YouTube video, a commentary for you, and I would really ask, I never do this, but please share the video because I think it has a large impact on people. And my title is, Why Isn't Dental Covered? The Hidden Health Crisis Nobody Talks About. Let me ask you something that doesn't make sense. If you had an infection in your arm, your chest, your brain, you'd be treated immediately under Medicare. Now, Medicare is Australian, I know. But whatever your country is, you'd be treated. But if that same infection starts in your tooth, suddenly it's not considered essential, even though it can spread, even though it can make you seriously ill, even though it can kill you. So, why is the mouth treated differently from the rest of the body? And I'm going to share my personal story. I'm not talking about theory. I'm living this. My son suffers repeated dental infections. Every couple of months, he ends up on antibiotics just to keep things under control. Not to fix it, just to stop it getting worse. He's been told only 6 of his teeth are salvageable. But because he has severe anxiety, he needs light anesthetic to get treatment. And that pushes the cost to over 5,000 Australian dollars. We're on disability support pensions. That might as well be $50,000. So what happens? He lives in a cycle of infection, antibiotics, temporary relief, and then it comes back again. And as a parent, you sit there watching it happen, knowing it's preventable, but completely out of reach. My own story. Last Friday, I went to a private dentist for a clean and was told I have 6 teeth. 3 need crowns, 1 needs a root canal. Root canal and crowns are not covered by an emergency dentist. And my cost, also thousands of dollars. I learned that when you go to the dentist, dental work is not permanent. I thought for years I've had fillings replaced, but now I've got a leaking filling, and I've had to bypass and misuse the emergency dentist to go and fix this week one of those teeth because I can't afford it. So I've been told I need root canal, crowns, and treatment for multiple decayed teeth. The public system, I've been waiting close to 2 years already. And again, the public system doesn't do crowns or root canals. And the expected wait time, 3 years or more. So, what are people like me supposed to do? And like I said, I've actually had or will be presenting to emergency dentist saying I've got pain just to get a leaking filling looked at. Think about that. In Australia, a country with universal health care, you sometimes have to bend the truth just to access basic treatment. That's not a failure of people. That's a failure of the system. Looking at the Australian history, Whitlam and the Medicare gap, to understand how we got here, you have to go back to the 1970s, when Gough Whitlam introduced universal health care. It was revolutionary. It meant Australians could access doctors and hospitals without fear of massive bills. But dental care was largely left out. Why? Partly cost, partly politics, and partly because dental had already evolved as mostly a private system, and that decision has echoed for over 50 years. Instead of being fully integrated into healthcare, dental becomes this separate system, whereas your ability to keep your teeth and your health depends on your income. Now, I want to also share what other countries are suffering as well. Okay, give me a minute. So, we have the United States, even more extreme than Australia. Dental is largely separate insurance. Millions skip care due to costs. ER visits for tooth pain are common and ineffective long term. The United Kingdom National Health Service. Dental is technically covered, but in reality, huge shortages of NHS dentists. People can't find appointments, many forced into private care anyway. Canada. Historically, very similar problem. Recently started expanding public dental coverage for low-income groups and still incomplete. Parts of Europe is a mixed picture. Countries like Germany and France have partial coverage. Nordic countries, much better access, especially for young people. Still often co-payments or limits. Now there's countries like Vietnam, Thailand and Mexico where dental care is much cheaper, not always because it's better funded, but because there are low labor costs, different insurance systems, and less regularity overheads. This is why dental tourism exists. So, let's get on to what happens if you don't get your teeth looked at. The medical reality. Here's what makes this more serious. Dental infections are not just about teeth. They can spread into the bloodstream. They can lead to sepsis. They can affect the heart. They can cause chronic inflammation throughout the body. This isn't rare. People have been hospitalized and people have died from untreated dental infections. I lost my husband to sepsis, not from dental issues, but once you understand what sepsis is, you realize how dangerous untreated infections anywhere in the body can be. So the question becomes, why are we willing to treat infections everywhere else in the body, but not when they start in the mouth? And again, global perspective. Australia isn't alone. In the United States, dental care is often completely separate from health insurance. In the UK, under the National Health Service, dental is technically covered, but in reality, people can't even find an NHS dentist. Canada is only just starting to expand dental coverage for low-income groups. Meanwhile, like I said, countries like Vietnam or Thailand, dental care is far more affordable. And this is not because the people there have more money, but because the system is structured differently. So you end up with this strange reality. People in wealthier countries often struggle more to afford dental care than those in developing nations. The core question plus challenge. So, what's really going on? Why is the mouth separated from the rest of the body in healthcare policy? Why is preventive care, which would save money long term, so hard to access? And why are people being pushed into crisis before they can get help? So this is a call to action, a petition and purpose. This isn't just a personal story. I'm speaking up because this is affecting thousands, if not millions, of people. People on low incomes. People on disability support. People who are quietly living with pain, infection, and stress because they simply cannot afford care. I'm calling for change, for dental care to be taken seriously as part of overall health, for better access, for systems that support people before things get worse. Because no one should be left choosing between their health and what they can afford. And no one should be living with preventable infections in a country that already has universal health care. So if you are living in Australia, write to your minister, write to the Minister of Health. The Minister for Health federally is Mark Butler. mark.butler@hbh.gov.au. I will put them in the description. Also, write to Shannon Fentiman if you live in Queensland. And if you live in another country, petition your your government, your member of the government. And I want to close with this. The mouth, our mouths, are not separate from the body. And it's time our healthcare system stopped pretending that it is. Thank you, beautiful, beloved souls, for watching. Please drop a comment. Do so respectfully. Can you afford dental care in your country where you live? And please, please, I never asked this, but share the video, share the message. We deserve better care. These people that we elected to government, they earn millions. Could you imagine if they put just less than 1% of their income towards helping the peasants? We would all be better off. I'm sorry. I'm upset. I'm depressed over this. My son could die. I myself could get sepsis, and we're not the only ones dealing with this. You probably are too. Please take care of yourselves. Be kind to each other. Love, light, and blessings. Bye.